So dissociative disorders, as identified as defined by the DSM-5, characterized by disrupted discontinuity of normal integration of consciousness, memory, identity, emotion, perception, body represents. So this list of sort of disruption of connection to reality, if you will, that can present itself as, how we think of psychotic symptoms of hallucination and delusions, but it is more extensive than that, more of a sort of overarching disconnection with reality or misinterpretation of reality, or a lack of awareness of, one's own existence. Now, those can seem fairly abstract, so we'll try to make those a little bit more quantifiable as we walk through some of these diagnoses. But a few more things in the preface section. So dissociative symptoms are often experienced as they use positive unbidden intrusions into awareness behavior with accompanying losses of continuous subjective experience. Again, we're like, well, that's a lot of words. It's not really clear what it means. I agree. This is really, again, about not just, misinterpreting your senses or sensing, or having, again, as in the form of hallucination, delusions, sort of perceiving things that aren't there, or distortion of perception. It's sort of it's even a, it can be extended to a lack of awareness of self, sort of an internal distortion, as well as distorting or misperceiving stimuli coming in. So again, we'll try to quantify that a little bit better. But in the preface section, the DSM goes on to describe such unbidden intrusions as fragmentation of identity, depersonalization, which refers to feeling unreal, that you're not actually there, that that you're questioning your own existence, or not so much questioning your own existence, but rather feeling like you're outside of yourself, like and some people might describe that they literally feel like they perceive that they see themselves outside their body, and almost in a very kind of visual, on auditory and sensory way. And it doesn't have to be that, but rather anything that kind of relates to feeling outside of oneself, to not connected with yourself. Okay. Derealization describes a detachment of, I think that's a type of their experiences of unreality, not in reality, but a sense of detachment from self, or detachment from one's surroundings. Like you are you're kind of aware of your own existence, but everything around you you're not sure about, or you don't feel connected to. So what the DSM describes as negative dissociative symptoms are the inability to access information or control mental functions that are or generally, or they're using their words, normally readily able to access or control. So let me get my little wand here. So positive dissociative symptoms mean things coming in that distort the again, what they call continuous subjective experience, the feeling of realness, the feeling of I'm here, I'm me, and I'm here in this place and time. Where negative is the inability to essentially control oneself, the inability to sort of, I'm this vessel here, but I can't access like exactly who I am, or what I'm doing. So a feeling of, that can include a feeling, and this is, has some, if it's this sounds like, domain of schizophrenia, in terms of this feeling controlled by something or someone else, or by forces out of your control. that it can be thought of as somewhat like that. Okay, and certainly amnesia and dissociative amnesia um, is probably the most common way that's experienced, and including sort of an immediate loss of memory, meaning like remember your childhood, but you feel like you're losing memory as it happens to you. So literally, as life is unfolding in front of you and you're involved in it, theoretically, you're not able to remember as it's happening. So we're kind of forgetting 10 seconds ago, if you will. Okay. So dissociative disorders for sure are anytime I've worked with someone who's diagnosis of a dissociative disorder, it definitely, even if there's a lack of sureness with the diagnosis itself, and I'll touch on that when I get into DID, clearly there's generally no question that there is evidence of significant trauma, even if it's only by the client's report. But certainly the trauma is there and often quite significant in terms of type of trauma, frequency, duration, intensity of the trauma, severity of the trauma tends to be strong, at least in my experience. I don't know that the DSM specifically says, well, it has to be, very serious or very strong trauma, the way PTSD defines, but, that's just been my experience. And yeah, I think, one of the reasons why it's good to get at least some of this dissociative disorder section in here, despite the controversy around DID, for example, or maybe DID specifically, dissociative identity disorder, in terms of how different people in the behavioral world, world of behavioral health feel about that diagnosis. There's no question that a lot of symptoms that we talk about here occur both in acute stress disorder and PTSD, and so and both of those are things that I, while I've not necessarily seen a whole lot of the disorders that we're going to go over here, I've seen a lot of acute stress disorder, a lot of PTSD, and those dissociative symptoms are very real. Okay, within those contexts, and not to say that they're not real in the diagnosis. We're going to talk about, just I've seen more of it. Individuals, sort of a restatement, right? That this is experience of discontinuity of identity and memory, and oftentimes people will, and I've definitely seen this, where people are trying desperately to hold themselves together while they just feel, this, and again, distinct from psychosis, but this just this loss of sense of reality to self and reality to the world around the individual. So stress produces transient exacerbation of dissociative symptoms, makes them more evident. Okay, well, that's a fancy way of saying when a person's under duress, and certainly someone may have a dissociative disorder, they may also have a depressive disorder, they may also have a generalized anxiety disorder, they may have panic disorder, and even absent of those comorbid conditions, when someone is experiencing stress, and especially if it's in the context of that they're trying to hold what they're experiencing internally, as we've talked about over here, they're trying to hold that together, where you apply stress, circumstantial stress, psychosocial stress, traumatic stress, even those symptoms tend to become, just becomes harder to hold them in. It's probably congruent with the symptoms of a lot of the disorders we talk about.